Hi, I'm Dr. Sitpathy, Sanjay Sitpathy, psychiatrist, board certified in American Board of Psychiatry and Neurology. I am in private practice for the last 15 years or so in San Diego. I also am a hospitalist at Sharp Mesa Vista Hospital. I'm also a child and adolescent psychiatrist and a interventional psychiatrist, period. This is Janessa, my TMS assistant who conducts the TMS on site. This is a presentation to present about transcranial magnetic stimulation and its efficacy and how we utilize it in our practice. I decided to be an interventional psychiatrist early on. I trained in India and I trained later on in United States in Brookdale University Hospital in adult as well as child and adolescent psychiatry. I also trained in Colombia with interventional psychiatry. I have been a provider for electroconvulsive therapy at Sharp Mesa Vista Hospital for the last 10 years. I have been a provider with transcranial magnetic stimulation in my private practice for some time. I knew the efficacy of interventional psychiatry from early on. I have had extensive training and education of medication management. And as a practicing psychiatrist, me and a lot of my colleagues have come across complex and difficult patients that have not been treated with medication management solely well. We have had to turn to interventional psychiatry, such as electroconvulsive therapy and transcranial magnetic stimulation intervention. ECT, or electroconvulsive therapy, has been an intervention in psychiatry that has been in the field for a duration of time. Most of the time, ECT is being taken as a last step intervention after failed trial of multiple treatment, including medication and therapy. Transcranial magnetic stimulation as an option of intervention initiated in the field of neurology and transitioned to psychiatry later on. Since the last 2 decades, we psychiatrists have been using TMS, or transcranial magnetic stimulation, as an option for intervention for affective disorder or mood disorder, especially for major depression. TMS is FDA approved since 2008, and we have been utilizing it much more commonly since the last 4 to 5 years. It has proven much more efficacious than pharmacological intervention to us. It's minimal adverse impact, and its ease of implementation has proven to be much more patient-friendly and patient acceptable. We use TMS, or transcranial magnetic stimulation, not as a last resort of treatment, but as a step intervention for treatment after failed trial of 2 to 4 medication management of at least 2 subfamily of medications. It has had a very strong ground in the treatment protocol, especially with a wide insurance approval and authorization for this process, for this treatment. We started out in this journey of transcranial magnetic stimulation, as I said, much earlier. And then we realized that if we stimulate a particular center in the brain that processes emotion with magnetic stimulation, we can have much better treatment results and much efficacious maintenance of symptom remission. And that's how TMS started out as a option of treatment in psychiatry. TMS is not, as I said, a last resort of treatment. TMS also is not a sole treatment. Medication management and therapy goes hand in hand with this intervention, and we accept this option of intervention as an adjunct intervention. We at so-called psychiatric care value our collaboration with providing clinicians, and we base our patient referral from community sources like you. We know the value of relationship with provider in psychiatry, and we give utmost importance to treat these patients with a strong collaboration with providers, and we return them back to the providers for continuity of care. Going to the science behind transcranial magnetic stimulation. As I said earlier, we realized by stimulating a particular center in the brain, which is called prefrontal dorsolateral cortex, we reach out to an area deeper in the brain called cingulate gyrus. And by stimulating that area, we see a significant remission of the symptoms of major depression. We can show results of that pretty clearly by a very illustrated picture here, where the brain of a depressed patient, which is prior to treatment, has less activation than the brain which is treated after treated with transcranial magnetic stimulation, which has had a lot more activation, and which signifies there's a biological correlate to their symptom remission with this treatment. As I said, the referral source for us are you providers in the community, and we'd like to assure you that the steps of referral from you are very simplified by us, and patients are going to be walked through with the expertise and warmth that they need. I'll have Janessa speak a little bit about the process of referral and how we do that here.
Yes, so with the referral process, we'll have the patient come in to meet with Dr. Sapathi, just to get to know him a little bit, and then he'll explain the process of what TMS is. And then from there, we'll go send in prior auths to their insurance. And while we send over the prior auths to the insurance, we'll notify the patient just about every day what's going on with their PA form, if it's been approved or if there's appeals, or just to have them more in the loop of what's going on instead of not knowing, have them waiting. So we like to keep the patient notified on every day on what's going on with their PA form. And as soon as it gets approved, we can schedule them for their first initial treatment, which is mapping, and that's Dr. Sapathi would do the mapping. And we can schedule the patient within, as soon as it gets approved, either the day after or a week after. But we try to have the patient in as soon as possible. And then doctor will do the first initial mapping, which is an hour. And every day for 30 to 36 days, 5 days a week, it will be a 20 to 30-minute treatment. And after the treatment's done, they could go back to their day-to-day basis life.
That kind of illustrates what's the process that they go through, and for 6 weeks time span. And as Janessa pointed out, they lead their very normal functional life through the treatment and are not incapacitated with the treatment. The treatment protocol includes an hour of mapping where we very carefully map the area that we're going to stimulate with this lead over here. And we use a technologically sophisticated camera that guides us to the area of the brain that we would stimulate. With both in conjunction of the lead as well as the camera, we devise the energy level that we are going to put in for the stimulation that we can do with our machine here. And we make sure that the treatment is focused and stimulated with the right amount of energy and is intensive. As Janessa pointed out, each treatment sessions are for 18 minutes. The entire process of registering and moving out of the session is approximately half an hour. We work with our patients very diligently as regards to the finances. We work with insurances for the coverage of this treatment. We also have a out-of-pocket fee schedule if patients need that to continue the treatment. I hope that this depicts the importance of this intervention, and I hope that you as provider source are informed about what we do with this treatment and how we facilitate improvement of your patients with their symptoms. Thank you very much.